The U.S. has just sent 500 million free COVID vaccines around the world, with more on the way. Over 110 countries in every region of the globe have received American vaccines. Jeremy Konyndyk is the executive director of the USAID COVID-19 Task Force. Jeremy, welcome to the program.
Thanks so much. Great to be here.
So tell us about the creation of the COVID-19 Task Force and how it fits into the mission of USAID.
Well, USAID's mission is fundamentally to show American values and American support by providing assistance to those who need it overseas. And so, what we're doing on COVID is a really natural, even quintessential expression of our mission, our mandate as the U.S. Agency for International Development. So we have been providing support to countries in need really since the very beginning of the pandemic in 2020. And of course, over the past year, as vaccines have come onto the scene, we've been working to provide those vaccines and also help countries not just to receive the doses, but to turn those doses into vaccinations, which is really the challenge as we head into the 2022.
And how does this effort benefit the American taxpayer?
Well, fundamentally, the greatest risks to the success of the COVID response domestically are now from variants that emerge overseas. And so, we saw Delta emerge from an undervaccinated population in India last spring, before India had achieved a large scale of vaccination coverage. We saw Omicron more recently emerge from undervaccinated populations in Southern Africa. And as we look to future variants, they are most likely to emerge from these populations that have not yet reached high levels of vaccine coverage. The best guess at where Omicron emerged, it was among a population, probably an individual who had a long-term COVID infection, who was immunocompromised, so their body couldn't fight off the infection. So supporting populations like that, making sure they have access to vaccines, supporting them with testing and antivirals so that they can further shorten the length of the infections that they might have, that's probably the greatest thing we can do right now to reduce the risk of future variants.
So this task force, Jeremy, stresses a whole of government approach. How are you working with other federal agencies to achieve this mission?
Well, the power of what the federal government can do when we're really hitting all our cylinders is immense. So we are working with partners from the Centers for Disease Control with their overseas immunization experts. We are working with partners from the PEPFAR program, that's the U.S. government's anti-AIDS program overseas. And that gives us a tremendous platform to work from in many, many countries, because we support many health systems through that. But we're also building on top of things like our polio programs, our polio vaccination programs, our maternal and child health programs, our malaria programs. So we have across the U.S. government all of these different health interventions that we maintain on an ongoing basis. And that provides an amazing foundation for us to then build off of in order to support countries in vaccinating their people.
So how much funding total has been allocated so far?
So for vaccine, what we call vaccine delivery, that's basically what happens once a vaccine reaches a port or an airport, all the way down to when it's injected into someone's arm. The U.S. government has allocated about $1.7 billion at this point. And that is in turn facilitating the delivery of more than 1 billion doses, 1.2 billion doses of vaccine that the U.S. has committed to provide and make available for the world. So it's really a substantial commitment so far, and we're currently waiting for Congress, hoping that Congress will pass some additional funding so that we can take this next phase of the vaccine delivery effort forward.
And what have been the challenges of actually getting those vaccines into the arms of people around the world?
The biggest challenge right now in many low-income countries is one of vaccine access. And it kind of mirrors some of what we've seen in this country, where you have a certain proportion of the population that are very motivated to get the vaccine and have jobs or lifestyles that enable them to take some time off to go get it. There are other, in developing countries, much larger portions of the population, which have daily wage labor jobs that can't necessarily easily get to a clinic or don't live near a clinic. And so what we need to do now is help countries to move off of this kind of static fixed site distribution that forces someone to come to a clinic proactively, and instead pushes the vaccine out into communities, out into markets, out into churches, out into schools and other places where people gather, so that it is more easy to access on their terms rather than kind of forcing them to come to a clinic or something like that that might not be so easily accessible to them. So making it more accessible is the biggest challenge. There are also some issues with hesitancy, like we see in this country. Generally speaking, not as politicized.
I was going to ask you, Jeremy, sorry to cut you off, about vaccine hesitancy and really misinformation about the vaccine.
Look, it's a problem everywhere. I think what we see in most other countries, it is not as polarized as it has become in this country. So the vaccine hesitancy is more, more about poor scientific understanding or just poor information. It's not necessarily as tied up in kind of political dynamics as it sometimes is in this country, but it's a real issue. And I think what we're finding is that there are ways we can combat that. So we've supported a really tremendous program in Ivory Coast that does real-time social media tracking of misinformation. And when that program detects misinformation spreading on WhatsApp or on Twitter in the local context, that is then immediately fed into some of the counter misinformation messaging, and that's pushed back out to help combat that, so that people have access to real information, but to real information that is kind of tailored and targeted towards the rumors that are spreading at a given point in time.
Can you share some success stories where USAID has really been able to move the needle and make a difference?
Sure. So, what we're finding as we're supporting countries with their vaccination efforts is when they have access to doses, when they have access to resources, and they have access to the kind of technical guidance and support that they require, they can make huge progress. And so we have seen that in quite a few countries. A lot of the lower middle income countries, so the countries like Vietnam or Pakistan or Bangladesh that have pretty capable health systems, they've made tremendous progress over the past half a year. As they have gotten access to the doses that they've needed, they have, with some technical support from us and a lot of donations of doses, they have reached very high coverage levels in their populations, and they're beginning to now approach the levels of coverage that we have here and in other high income countries. The next phase is really supporting those countries that don't quite have that level of resources and providing them with the resources that they can then take their vaccination efforts forward. And so what we've seen in a number of countries in Africa over the past few months is, again, when they get that combination of support, of targeted support, they can make great strides. And so in Ghana, for example, Ghana has now achieved first shot coverage to about half its population. Uganda, likewise, with the help of a big push from of U.S. government support last fall, was able to get coverage of more than half their adult population, rising from about 14% to almost 50% in the course of just over a month, with a big push of support. So we know that this is possible, and what we're trying to do now is to take some of those examples, those proof of concept examples, and deploy the resources to really scale that up across all the countries that continue to need it. And that's why we're in the process of working with Congress to try to secure some additional funds for this, so we can take those from being a few examples that show the proof of concept to really blossom that into a program that can help to vaccinate the whole world.
So Jeremy, how do you define success, though? And at what point can this program be ended?
Well, the World Health Organization has set an aspirational global target of 70% population coverage in every country. And that's a good target. It's a hard target. And in some countries, it's an aspirational target. We're still at about 65% even in this country, but we're continuing to plug away at it. So we want to support countries to get as close to that goal as they can. That is what we'll work towards. But also importantly, it's critical to target those who are most at risk. So it's not just any 70%, it's the right 70%. So we want to help countries to target elderly populations, people who are immunocompromised, as I talked about earlier, both because they're at the highest risk of a severe disease outcome, but also because they are the highest risk population for incubating new variants. Also ensuring that countries can support their frontline workers, their healthcare workers, and other, other populations, other people who may face elevated exposure to the virus.
I wonder how you pick the countries that you're going to work in, because you'll have to prioritize. You don't have unlimited resources.
Yeah, what we're doing right now is trying to support those and target those that are the most ready to accelerate. So we're trying to help countries accelerate their rates of uptake now that there are sufficient vaccines available to anyone who wants them. And so where we see a country that is showing a lot of political will, a lot of leadership from the government. So a country like Ghana, where the president has been really engaged and really willing to do what's required to deploy the health system, to work with the population, to show leadership. A country like Uganda, where the Minister of Health has been going out to district by district to launch local vaccination campaigns. That's a strong show of support from the government. A country like that, then we can come in, provide support to that, come in behind that government leadership, provide support to them, and really make real progress.
Jeremy, are other countries donating vaccines? I wonder how your numbers compare to other countries.
So the U.S. is definitely leading the way in terms of countries. We have donated more doses globally than any other individual country. But we are seeing a lot of other countries step up. So the Europeans have donated many doses as well. The UK has donated doses. Australia is donating. We're seeing a real kind of snowball effect in a positive way of increasing donations, increasing support, to the point that really dose supply is not the problem anymore. There is plenty of supply available to any country that wants it. The challenge now is helping these country health systems that often are quite weak and that have never had to vaccinate their whole adult population before to take that next step.
I hate to mention the next pandemic, but what is USAID doing to be better prepared when the next global pandemic hits? What have you learned from this one?
We've learned so much. I think we will be working through the lessons of this for a long time. I think a couple that stand out for me. One is the importance of early warning and early action. The earlier that action is taken to protect the population, the more that can be done. It becomes harder and harder to slow the spread of a virus the longer you wait and to begin to do so. Another is the importance of trust. And we've seen this, again, this is not unique to any single country. We see this in every country, that when there is trust in government, trust in institutions, people will be more willing to abide by public health protections. They will be more willing to get vaccines. And that's something, frankly, we've seen in many, many outbreaks. I worked several Ebola outbreaks in the past. We've seen, even with the Ebola vaccine, a disease as terrifying as Ebola, as terrifying at an individual level as Ebola, it was hard at times in Eastern Congo to persuade people to take the vaccines, and working through trusted local leaders, trusted local voices that could be validators for an unfamiliar message was really, really critical. So thinking about trust and communication as core elements of public health.
All right. Well, Jeremy, appreciate your time. Thanks for being on the program.
My pleasure. Thanks so much.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.